My name is Representative Liana Cassar, and I represent District 66, Barrington and Riverside. But what we're talking about today really impacts all of our communities. I'm grateful to be here with you and to be with my colleagues in support of the Equality and Abortion Coverage Act, which will make access to abortion safe, legal, and affordable for all Rhode Islanders. Reproductive freedom is about personal, medical, and economic choices. Rhode Island's progress in 2019 with the Reproductive Privacy Act was a great step. It resulted from the work of leadership of many of you in the room, but also many in this building and many across the state. Our charge this year, in 2020, is to assure that the protections and access to care extend to all women and all families. We're working to protect the right to abortion and ensure true access to affordable and compassionate care for all Rhode Islanders. For all of us, we know that healthcare services are overwhelmingly impacted by who our health insurers are. Right now, there are people in our state for whom there's a barrier to access to abortion solely as a result of their insurance coverage. This population is the population that are Medicaid recipients, as well as people covered by our state plans. Access to abortion will always be within reach for people with financial resources. However, for people with limited financial resources, we need to be sure that their reproductive freedoms and their ability to control their own bodies and their own futures are also protected under the law. Right now, 1 in 4 Rhode Islanders does not have full access to reproductive choice due to their insurer. All Rhode Islanders must be free to determine if they parent, when they want to parent, and how to build their families, no matter their income level, insurer, or employer. All Rhode Islanders must have access to the services they need to live out their choices, free of barriers, in a culture of dignity and respect. And our healthcare providers need to be able to provide the highest quality of care for all patients. I'm grateful to my colleagues here today. I see my colleague, Representative Knight, Representative Nidello, Representative Kislak, Representative Bennett, Representative Donovan, and my Barrington Town Councilor, Jacob Ryder. And I know that Senator Pearson was here as well. Maybe here, but it did not see better. And I apologize if I've missed anybody. We will certainly make sure to recognize you throughout this session. But I'm also grateful to my constituents who have made it clear that the passage of this bill is a priority of theirs this year. And I am grateful to all the members of the Coalition for Reproductive Freedom, for their advocacy, for their education of all of our constituents and our legislators, as well as their support for this work. I urge you all to continue organizing and educating on this issue, and I look forward to working with my colleagues to get the Equality and Abortion Coverage Act passed this year to assure that abortion is safe, legal, affordable, and accessible.